Do you have macular degeneration? Here's a couple of tips and tricks for how to monitor for vision changes at home and to know when to call to be seen. Macular degeneration comes in two forms. One's dry, one's wet. The patients with dry typically have better vision long-term and less visual damage overall. It can convert to wet at any time with no warning at all, and the quicker that you come in to be seen, the better the visual recovery to get that vision back on track. So how can you monitor for this? We typically hand patients a grid that's called an Amsler grid, and it's a really great tool to monitor your vision for changes at home. What you'll do with this is you're going to wear your glasses that you typically would have on to read or see up close. Hold that card about 12 to 14 inches away from yourself and cover one eye either with your hand or kind of wink it shut, looking right at that little white dot in the center, and ask yourself some questions. Can you see all four corners of the grid? Are any of the lines wavy or distorted, and are any of the boxes missing? The first time you do this, you might have some of that distortion, and that's normal. Just use that as your baseline, and then each time you check, if you notice any big changes from what the grid typically looks like, that would be a trigger to call right away to be seen within the next day or two. If you do get a new spot that looks really distorted or wavy, or a big area that's missing, chances are you could have a new bleed or something inside of the eye that has converted your dry macular degeneration to wet, or has caused your wet macular degeneration to leak even more. And so coming in promptly is the best way to recover that vision and get it back on track. Other really great things you can do for yourself with this condition. No smoking is a really big one. UV protection anytime you're outside. So glasses, sunglasses, something that has a UV block anytime you're outdoors. Dark leafy green vegetables like spinach and kale are really good for your retinal function, and those eye vitamins that are over the counter that are called Preservision or Ocuvite, things like that, work really well also. What you want to look for is that it says AREDS 2. That's a specific type of formula. Even the ones that are generic and no-name brand work really well still, as long as they say that they're AREDS 2 formula based on them. So beyond that, coming in for regular checks is how we can typically pick up on your macular degeneration changes from the get-go, and then knowing about all these risk factors and ways to monitor at home can help you keep this condition as stable as possible.